It's never one person or a pair like Count Gibson and myself. It's tens and then hundreds and then thousands of people who are involved in making health centers real.
The practice of caring for an individual or a family within the community started right here in Boston 50 years ago with the establishment of the first community health center. Both doctors Jack Geiger and Count Gibson, who were from Tufts Medical School, envisioned community-based neighborhood health centers that would treat the entire family rather than just isolated medical problems.
I remember talking with Count Gibson and Jack Geiger just after I arrived in the Senate about this new idea that they had developed out here at Columbia Point.
They in fact invented the patient-centered medical home 40 years before this concept was adopted nationwide by the medical system at large. Jack Geiger saw community health care as an essential part of the civil rights movement. It began with residents being organized and eventually led to empowering communities in the broadest context of improving overall health.
Hola Gladys, ¿cómo está? Mucho gusto de verla, tiempo de no verla.
They're not more dedicated, more concerned, more passionate, able, more gifted, or talented people than those that work in the neighborhood health centers in their community. These are men and women that take a source of satisfaction about making a difference in people's lives.
Thank you.
Every day, community health workers carry forth the legacy of the movement to better the lives of some of the most vulnerable people in our Commonwealth and across the nation.
This is actually Dr. Roeder.
Good morning, Dr. Roeder.
Practice within community health centers can become far more important than just providing primary care visits. Community health centers have state-of-the-art buildings and equipment and information technology and the intangible assets of working with the community to become part of the movement, to engage in the community governance, to look at communities and to assess their needs and then try to meet them. These all go beyond the basic model of delivery of primary care services. This is what the movement's all about.
I don't know what America would be like if we didn't have community health centers.